Hi, I'm David Blake Jones, the owner at Return of Function Acupuncture. I've had a great clinical success recently that shows the power of acupuncture to relieve pain and restore function. A patient who had been born with spina bifida and had walked since childhood with a limp recently presented with a chief complaint of pain in her right hip joint. This had been diagnosed as bursitis. Her pain was at a MYOP-2 rating of 5 out of 6. The pain radiated along her IT band. She had suffered from hip pain for 5 years. The pain was made worse by walking, lying on the right side, and standing on the right leg. The patient also complained of pain in her upper right buttock and pain in her right hamstring and lateral right knee when driving. Secondarily, she complained of chronic lower back pain that was worse with bending. Based on manual muscle testing, palpation, and her presenting symptoms, I identified likely myofascial constrictions in left and right hip flexors, left and right TFL, left and right glute medius, right glute minimus and piriformis, right hamstrings, and right vastus lateralis. Based on her exterior symptoms and on her weak kidney pulses, I made a diagnosis of qi and blood stagnation and kidney yang and yin deficiency. Her treatment plan called for 4 treatments over 10 days to assess rate of response, as well as both local needling of motor and trigger points and distal needling. The goal was to release myofascial constrictions, mainly on the right side and surrounding the hip joint. The local needling in this approach is supported by a recent study, Brennan et al., that showed dry needling, also known as local acupuncture needling of myofascial constrictions, to be a non-inferior alternative to cortisone injections for greater trochanteric pain syndrome. In addition, the patient was provided instructions for stretching the muscles involved in her pain. After her first treatment, the patient reported immediate relief and enjoyed a reduction in pain through her next 3 visits. Right before her 4th treatment, we did the MYOP-2 rating again, and the patient reported even greater pain reduction in her right hip pain. The pain was now down to only 1 to 2 out of 6 during the day and down to 3 out of 6 when lying on the right side at night. The patient reported that there was still some discomfort with walking and standing at work, but that it was, quote, not nearly as painful as before, unquote. Both pain in right hamstring and the right knee while driving had gone, and the low back pain had also gone. Based on these results, I will treat this patient twice per week for another month and then reassess. The patient has also begun taking a customized Chinese botanical formula that will complement the blood-moving, analgesic, and anti-inflammatory effects of the acupuncture treatments. This formula contains an herb called Yan Hu So. According to the E-Lotus Oriental Medicine Manual, this herb has a strong analgesic effect comparable to morphine. A PubMed search for studies on the effects of Yan Hu So, or formulas with Yan Hu So, reveals animal and human research from basic research to clinical trials to one meta-analysis for cancer pain that suggests this herb has significant analgesic properties. In fact, according to one animal study, Hu et al., Yan Hu So is synergistic with electroacupuncture. Due to this patient's congenital abnormalities, she will likely need to manage her condition with regular stretching, exercises, weight management, and acupuncture and herbal medicine maintenance. To see the references to the studies mentioned in this video, please look in the text box below. Thanks for watching.